Welcome everyone back for another episode of the Pyramid Game Retina Edition. This is volume 2.0 with our remaining contestants in the game. We've got a couple teams here still remaining. Team Peloton is here with, I believe it was a perfect score, or there it is, 100% on their first round. And in addition, we have these sisters, the Intrepid sisters here, that made it through a really close battle. Came down to the wire, came down to one question with 1 second left in one of the rounds. So great competition last time. I look forward to seeing what you all have to bring to the table this week. This is going to be a little harder. We're going to step up our games here. And I hope you're all ready for the challenge. We're going to focus a little bit more on GA. If you don't know what that is, you can just sign off now. But we're going to focus on geographic atrophy.
I was looking for the exit button, Jacob. Hold on.
So again, thank you everyone for joining us. We're looking forward to your contributions in the chat area. So if you have a guess or a thought, or feel free to chime it in. If you want to give us a little heckle, we're looking forward to your contributions as well. And with that being said, let's get to know our teams here a little bit. The team that's going to be going first is the Intrepid sisters, as they went last time. We have Dr. Cecilia Ketting and Dr. Carolyn Major. Dr. Ketting practices at the University of Colorado in the School of Medicine, Department of Ophthalmology in Denver, while Dr. Major is an associate professor and director of residency programs at Northern State University of Oklahoma College of Optometry. The second team again is the Pelitons. Pleased to welcome Dr. Mark Blumenstein, who is currently Director of Optometric Services at the Schwartz Eye Laser Center in Scottsdale, Arizona, and President of MRB Eye Consultants. His teammate, Dr. Jeffrey Gearson, who is in private practice in Kansas in an integrated OAD MD setting. Just to go over the rules of the game again. So we're going to have 7 clues. Each team is going to get 7 clues, and they have 120 seconds to get through those clues. We're going to have someone that presents clues, and someone that's the guesser. And so this is kind of like verbal charades. And if they get too close to the word, or they say the word, I'm going to give them the big X. We're going to buzz them. We're going to give them the pineapple. And that will be X from their score, and we'll move on. The teams do have the ability to pass. They can move forward, get to the next clue, and then come back at the end if they have any time remaining. All right, so let's see our first 6 subjects, or the subjects for tonight. Let's see our categories. We have alphabet soup, the root of all evil. You'll notice the Minnesota accent there, Mark. Weighing the options. You ought to know. Tell me how you feel, how you really feel. And get me the manager for any Karen optometric players.
Wow.
Here,
you know what though? For all the Karens watching this, I'm sorry that Jacob said that. How about for all the Jacobs out there?
All right, we've been getting a little distracted. Let's get back on target here. I'm going to ask the Intrepid sisters, as they're going first, to select a category.
Yes, Jake. I'm going to pick the root of all evil.
The root of all evil. Geographic atrophy, or GA, pathophysiology and disease mechanisms. You're going to describe for your partner these potential root causes in the disease mechanism and pathophysiology of geographic atrophy. Let's send those clues over. I have my timer ready. Intrepid sisters, do you have everything you need?
Believe so.
On your mark, get set, go.
The base cause of ocular surface disease, we look at blank on
Dryness.
the surface.
Dryness, atrophy,
What?
desecration, degeneration,
Mediators, MMP9.
inflammation.
There you go. When I go from being 41 to 42, years of age, I am
Aging, older.
Pineapple.
Yeah, I'm gonna pineapple on that. Okay. My parents, when they made a baby, they
Family
made
history.
me, and they passed
Genetics.
on. Say that.
Family history, genetics.
Yes,
Genetic
there we go.
makeup.
If I want to say that you look very beautiful this evening, I am giving you a
Compliment system.
There you go. My body burns food,
Fat, cholesterol,
and how quickly it burns it is my
metabolism.
Yep. And when I don't like my job because it makes me the second word.
Slow metabolism. Well,
First one is
grumpy metabolism.
so we're gonna put the first word and then we'll come back to that. So when I breathe, I'm breathing in
Oxygen.
You got it. And the second word is
Radicals.
When
30 seconds.
When I have a lot of weight on top of something, it's creating
Pressure, oxygen, oxygen
Pressure.
tension, oxygen pressure. Decrease. Low.
I'm trying to think of another way to
Clues.
describe this.
10 seconds.
School, when we were in
Oxygen
school, we
tension?
were very what? Tests did what to you?
Anxiety.
Yeah,
Time's
another
up.
word.
Stress.
There you
Oxidative
go.
stress.
Oxidative stress.
You got it. You got it. Yes.
No, but they didn't get it in time though.
The
Did they,
first one,
Jacob?
the one
No, they
before
did
that
not.
was
Yeah. No. Time was up. Time was up. Time was
but
up.
you still got it. I'm proud of you. The one
But
other than that,
I got it too. I got
metabolic
it too. Are you
stress.
proud of me?
No stealing.
Yeah.
There's no stealing
Oh.
points here.
Oh, damn it. Damn it.
That was a hard one, man.
Great work. Great job.
Good job,
Definitely
Kirsten.
tell they're sisters from another mister. All right, Team Peloton, are you ready?
No.
I think we
Jeff, have
have,
we decided which category we should go for?
we haven't. No.
Should we do tell me how you feel? Tell me how you feel, but you really, really feel.
Sure. Let's
You know what? It can't be any better or worse than any others.
All right. So, Mark, you're going to be the clue giver. And
Shite.
Jeff is going to be the guesser.
All right.
Oh.
So we're going to send over the clues to Dr. Blumenstein. And
Red Rover, send over the clues.
My timer is ready. Is Team Peloton ready?
No, but we're going to do it.
I love it. All right, we'll get started in 3, 2, 1.
So there's two words. The first word is something that's not clear. It's
Foggy, blurry.
yeah.
Blurry
The second word is what we check. It's the first word in front of acuity. What do we see? What is it called?
Oh, visual, blurry vision.
Yes.
Correct.
Okay. The second one is okay. It's when you go up into a monitor and you have to use your punum, and it has to look
Face?
at that. Okay. It's what is it doing? It's doing that. It's what is it doing to be able to get you to know what it is? It's two words.
Close face, near face.
No, it's like instead of using your fingerprints, you're using this
Oh,
to be able.
facial ID. Face.
Okay, but it's
facial visual field, face field,
no. It
Facial
knows it's
recognition.
you. How does it know it's you?
facial recognition, facial features.
Yes, you got it. Okay. So people who need to have magnifying glasses is because they're having challenges doing this.
Seeing things.
When you pick up a book, you are
Reading.
and it's challenging. So it's called. It's not
Reading.
easy. It's
Difficulty reading.
yes.
I'll count it.
Thank you. Okay, when you're in a room like this and you don't have enough light, it's
Dark.
or less dark.
Dim.
It's and remember that other word we used before when we talked about things not being clear?
Dim, blurry, dim vision, dim acuity.
Yes, dim vision. Good. Okay, what is it that we measure a visual field for? What are we looking for?
Peripheral vision.
No, when we're doing visual fields and there's something that's dark on the visual field. What's it called?
Time's up.
It's good time.
Great work. There's definitely a team aspect here. You can tell the team's come together.
Yeah.
Yeah.
All right. So we're back to the sisters for their second shot at glory. And we're going to switch roles. So Dr. Major's going to get the clues. Dr. Ketting is going to guess the clues. What category would you ladies like for round 2?
I want to go with you ought to know.
You ought to know classic signs of AMD and geographic atrophy. Describe for your partner these classic clinical signs of age-related macular degeneration and or geographic atrophy that all eye care providers should recognize. Okay. This seems like it might be all eye care, so I think you might have picked wisely here. So we'll see how this goes. Let's load those clues up. And Dr. Ketting is the guesser here for her. This isn't going to be anything to do with the cornea. Are you ladies ready? All right, I will start the timer in 3, 2, 1.
This is a yellowish deposit at the level of the RPE.
Bruisen.
Yep. New blood vessel growth.
Neovascularization.
Very close.
Choroidal
The first word
neovascularization.
you got right, and then it's what it actually is, like a
Neovascular
film.
membrane.
Great. I'm gonna pass on number 3 for a second. Number 4, this is attenuation or degeneration, sort of thinning of a certain layer.
RPE, OPL, IPL.
But it's a blood vessel layer underneath the RPE.
Choriocapillaris.
So close, but these are bigger vessels, just a more general term.
Choroid.
Yep, that's the first one. And then the second word is this like thinning or attenuation. It's in the
Choroid.
like GA. What does the A?
Atrophy. Choroidal atrophy.
Yes. Good. 5. This is using fundus auto. I don't know
Fluorescence.
if I could say it. Okay,
Okay.
but what geographic atrophy where the RPE is missing would exhibit what type of?
Hypoautofluorescence. Hyperautofluorescence. There we go.
Wait, which one?
Hypoautofluorescence.
Yes. Okay, great. This is what's left over when a neovascular membrane kind of becomes fibrotic, and it forms pigmented something in the center of the macula.
30 seconds.
Pigmented membrane.
So close, but
Pigmented.
a more general term. Like if you get like a scratch on your face, you end up with a
Scar. Pigmented scar. Scarring.
Scar is correct.
Macular
The
scarring.
first word, it's think about throwing like a frisbee.
Okay.
5
Pause.
seconds.
How to say it? It's round.
Okay. Circular atrophy.
Time's up.
I think we did pretty good.
Yeah.
I think you did great.
Disciform scar.
Disciform.
See, you had me
like,
confused with throwing the frisbee.
I know that was actually perfect.
Yeah, I was thinking, yeah.
Yeah.
I thought that was in the bag with your, cornea stuff. So I thought disciform would get you there. But all right, moving forward here, on to Peloton for their second round. Dr. Gerson, do you have an option that you'd like to select?
Well, I'm not sure, but we're going to go after the tip of the spear here, and we're going to take alphabet soup.
Alphabet soup. Alphabet soup. Acronyms related to geographic atrophy. Describe for your partner these important acronyms that are pertinent to geographic atrophy, either regarding diagnosis or management. Please note that this is going to be a challenge. There's so many acronyms in eye care, and especially in the retina, that the world is your oyster here. So I hope you're up to the challenge.
Jacob,
I'm not
Jacob,
sure
can we make these each one worth 2 points? So to even things out here.
I'll take it up with the committee.
Okay, thanks.
We appreciate it.
1 point per letter in the acronym. How's that sound?
There you go.
All right. So let's we're gonna put 2 minutes on the clock. We're gonna load some clues and see if we can get Mark to guess some letters that he might see in charts. Are you gentlemen ready?
No.
No, but let's go.
I'm pretty sure both of you were born ready. So we'll be starting in 3, 2, 1.
The clinical trial that was done so we know what vitamin to use in macular degeneration.
AREDS. AREDS.
Not the first one.
AREDS 2.
Yep. Something that is under. A boat that goes underwater.
A submarine. Sub.
The back layer of the eye.
Retina.
So
subretinal neovascular. SRNVM. No.
No. The little yellow things that you see.
Drusen.
And then those are types of a. If you go to the bank, you make a
deposit. SRDO. Subretinal.
You said drusen.
Subretinal drusen.
And then the
deposits.
Bank.
SRDD.
I'll accept it.
Forget the D. Oh, we got it. Okay.
Subretinal.
I got it.
If you don't do all of something, if you only do something partially, it is
half? No. Less?
Okay, we're gonna skip 2. I'm going to number 5. The Mediterranean
C.
And then one of the layers of the retina is the
ganglion cells. You
can have a no, keep going farther back in the retina.
Further back in the retina. Choroid. The retina ganglion cells.
We got the first part complete, and then we're talking about geographic
atrophy.
So complete is the
complete retinal atrophy. No.
Complete is the first word. Atrophy is the last word. There's 3 3 letters in between.
Oh my God! How many more letters?
Okay.
Time's up.
The complete outer retinal atrophy. CRORA.
Yes, CRORA. Yes. Okay.
Wow.
I'm gonna skip back.
We're out of time.
Time's up.
We ran out of time.
Yeah. Our 2 minutes was over before we got to the complete retinal.
That was.
You know what? This is called karma. You know what? Because we were too cocky, Jeff. We were too cocky for the
You
last
didn't wear the bling.
That was me.
Just saying.
Yeah.
It may have been the jackets.
You know what? There's still time for us to come back. In the third round.
I would never count any of you guys out. So, all right. So we do have a third and final bonus round for each team, but this time I'm going to allow you to pick who is the guesser and the giver. Who's the guesser and who's the giver? So, ladies, who do you want to be the deliverer of the good news, deliverer of the clues?
I don't know. I think we both kind of end up equal on this. What would you like, Carolyn?
I'm fine with either way. Whatever you're most comfortable with.
I'm more comfortable.
She is a retina doctor.
I know, but she's going to know the words better than I will. So I'm going to be the clue giver.
Okay, you're going to give the clues.
Yeah.
And Dr. Major's going to be the guesser. And we have 2 options left, so you get the final pick. And this, I'm not going to put a lot of pressure on you, but this might be big.
I'm going to say weighing the options because I don't want a Karen.
All right. Weighing the options. Current and future treatments for geographic atrophy, or GA. Describe for your partner these various approved or experimental treatment strategies for patients with geographic atrophy. So these are approved or experimental treatment options. So these are things you might recommend to your patients with geographic atrophy. Let's load the guesses or the clues. And I'm resetting the clock. How are the sisters doing? Are we ready to rock?
You're ready.
I'm ready. Are you good?
Okay. Loaded the clock. Are you ready to rock?
Ready to
3,
rock.
2, 1, starting.
Another word for vitamins.
Supplement. Minerals.
What's the word in front of supplement?
Vitamin
You get this
supplement.
for food.
Nutraceutical.
First word.
Medical food.
No. You said you were saying something suitical.
Nutrient
Uh-huh.
supplement.
Very
I'll
close.
accept it. I'll accept
Yep.
it.
Okay. There we go. If I'm gonna watch someone, I'm doing what?
Observation.
You got it.
Monitoring.
On the front end of the house, I use this to treat inflammation, and it can side effects increase in IOP and cataract.
Steroid. Corticosteroid.
Yep. There you go. When I'm going to send this to my friend who likes to set my patients up with devices that help them see better.
Low vision rehabilitation.
You got it. Again, my parents gave me these, and then I manipulate it, or I do.
Genetic manipulation.
But what's
Genetic
another
therapy.
Yep.
Gene therapy.
You got it.
There you go.
If I'm going to say you're wearing a lovely dress, that's the first word.
Complement inhibition.
You got it.
Therapy.
With the last one, ooh man.
Abacid-captad pegol.
30 seconds.
Okay,
don't
first
know.
part of this word, I take this with a camera,
Photo.
right? Next one, a class I took in college that I probably also majored in to then go to optometry school.
Photo optics. Photo physics.
The
Photochemical.
the middle word is the first 3 letters of a class you took in college that was a prerequisite for optometry school. Ology.
4, 3, 2, 1.
Photobiology. Photobiostimulation.
Oh, so
No!
close.
Was it photobiostimulation?
Photobiomodulation.
Oh.
Photobiomodulation.
Wow, that was impressive.
Yeah. Hey,
was
Jacob,
pretty good.
Jeff and I would like to throw in the towel and just I
This is
think
a-
Caroline, who lives in Oklahoma, could use the belt better than I could. So, yeah.
So we pass.
It's not over till it's
Yeah.
over.
Seventh pass.
Do you stop your Peloton rides early?
No.
Oh, maybe he
No,
saved it
I
for
have-
after
no.
this.
Good
You know
point.
what, Jacob?
I feel
You're
better.
right.
It
Okay,
is
I'm
not
taking
over.
it in. Let's do it.
Let's do it. Let's do it.
I am
Oh.
going to be given the clues.
So
I will be
get the
Blue's
manager, and so you are assigned to get the manager, and you are getting the clues.
Yeah.
Get the manager. Geographic atrophy management and referral strategies.
What?
Describe for your partner these important management strategies or indicators warranting referral of patients with geographic atrophy.
All right, I'm going to do this, Jeff. So be ready.
All
So
right.
these are things that kind of go with the care of the patient, whether it might be in your clinic or sending them outside your clinic and things like that. So care of a patient with geographic atrophy. So 7 clues. I've got the clock.
Jeff, are you
locked.
good?
I'm
Jeff, are
good.
you ready?
I'm ready.
Okay.
All right, starting in 3, 2, 1.
You don't show up late. You show up,
Early.
and then when you want to look at something, you're like a private.
Heart.
No, a private, a PI. What are they called? Private.
Investigator. Early investigation. Early detective. Early detection.
Yeah.
There you
Yes.
go.
Okay. The person sitting in your chair who you're examining
Your
is
patient.
called the. Okay,
Your
and
patient.
you're talking to them. You're getting. You say
Patient
it?
education.
Yes. Yes. When you use an OCT, you're doing.
Diagnostic
When
testing.
you take a picture, what's the global
Documentation.
term for that?
Documentation. Photography.
Nope. It starts with this.
Ocular. Eye.
Nope. What is it? What is it when you're looking at the retina? You're taking an.
Eye exam.
All right, let's skip this one. What are the types of glasses that you and I need to wear because we're in our 50s?
Bifocals.
No,
Progressive.
they're okay. And then what is it? Remember the word in front of
Progressive.
acuity.
Progressive visual acuity loss.
And then
Count
I
it.
said it. Good. Hey, what is it? Okay, so we look for. Okay, if you're as you get older, what are we doing? We now. Okay, if you look in the back of you were looking in the back of the eye for something that's dark colored,
Something
30 seconds.
like a melanoma is what? Or
Pigment.
no,
Pigment.
but it
Tumor.
more globally. Okay, what?
gnats.
Nah, skip that one too. What's the store that we go to because we think it's cool with the bullseye? It's red and
Target.
white. Huh?
Target.
Yeah, but it's more specific. It's
Superstore.
no.
Time is up.
Cecilia, what would you have done for that one, Caroline? Because I know you know what it is. I know you know Target.
Target inhibition. I don't know.
Targeted.
That's a
Targeted.
really hard one.
Target. I want to go back. to the. Okay, so you're taking a picture or you're doing an OCT. You're doing what? Can either one of you guys get that?
Multimodal.
I wear a beanie because it's part of my what?
Routine.
No, imaging.
I think I said that.
You know what? I don't think you did. I'd love for you to say that.
Look at the
I would love for you to say that.
You guys fought a hard battle and
Not
you did a
hard
great
enough.
job. So I just want to thank you, both teams, for being here and giving it your all. I really appreciate your dedication to geographic atrophy and to the Pyramid Game, Retina Edition. We want to thank our sponsor, Astellas, for letting us have fun together and hopefully bring you some education along the way. There were 21 questions that we asked, or 21 clues. The sisters came out with 13 correct. Peloton finished with 9. Close
I
second.
wanted double digits.
Yeah.
So a real
I'll
hard-fought
take it.
battle. Hard-fought battle, but actually coming from behind the sisters. I think
No.
between last time and this time, there might have been a lot of
It would've
studying
been real
going on.
close.
Yeah.
So let's give a round of applause, everyone, to our teams here, to our winner, the Sisters of Intrepid, and of course to our second place team, the Pelitons. And thank you, everyone, for joining us in the chat. We really appreciated your comments along the way.